Good evening. Okay. I spoke a little bit on this earlier about doing some soul searching in my head, and how I went seeing the neurosurgeon. I didn't know I was going to see a cardiologist too, and stuff like that. But I really like my doctor from the Maine. OSU, Wexner, University Wexner Medical Center. Very good. Dr. Lacani. I think he's talking right to me in terms that I understand. But I don't know anything medical. And I really freak out when it involves me. Right? I don't know anything about that kind of stuff. I just follow my doctor's advice. I follow my primary care doctor at the VA, Dr. James. She's very good. I know she wouldn't mess with me. We've been together for so long. She wants my best. She's in my best interest. Even though sometimes everything feels like it's totally against. Yeah. She's always yelling about, when are you going to start taking care of yourself? When are you going to start taking care of yourself? When are you going to... I don't even know what that means. I try to eat good, but I probably drink more than I should. And I definitely, it's finally dawned on me, this smoking. That's what Dr. Lacani and I were talking about. All right? Now look, they want to see the backside of my heart. Because it's crazy that you're not paraplegic or dead. I had 2 simultaneous strokes going on at the same time. He said, and that tells us that you have an irregular heartbeat. And they said, you had one before. And I go, yes, I did. And that was 3 weeks. I was about 27 years old. 3 weeks after my congestive heart failure. In military service. And they put me out. And they didn't even treat me for that. They found me on the floor unconscious and took me to an institution rather than to a medical facility in Rhine, Maine and Frankfurt, Germany. Yep, and that's what they did. And the P&P doctor at the VA said I needed more proof for my 100% compensation. Well, I just might have it here. Just might have it here. And x-rays. And all that. Because I've never had a stroke before. Other than the first one. And I didn't even know what it was. Alright? And I didn't even attempt to walk. They threw me on a cart and drove me there. And just left me in the bed. Put me on a surface. Okay. So here's my thought. I could do. They're going to do this thing on May 7th at the Western. I really dig my neurologist, and the woman was really pretty cool. I didn't know who she was. I guess she's a heart doctor, cardiologist. So I guess I'm gonna look at the back side of my heart, and I have to be put out. And Dale's got to go with me, I guess. I got no family left, nobody. So Dale's gonna go with me. My cab driver's going to pick him up at the VA Service Commission and take me too. And we're going to go down. And he's going to sit there for however long it takes. It should be that long. Just skin. The backside of the heart. It's kind of like a colonoscopy, they were telling me. But the other end. So go down from my esophagus or whatever they call that, and behind my heart, and look at scope my heart. I want to see the backside of it because it's obvious. They said obviously something's wrong. I said, oh, there's always been something wrong. Dad said the family, all the men, we have heart problems. I guess at least I'm going to get some help with this. That's cool. And he ordered a little higher level of blood pressure medicine, a little higher level, well, quite a bit of level of my statin. From 40 to 90 milligrams, and he said, here's where you come in. You stop smoking. And we don't have to call you in for we find something with your heart. And by 7/8/2026, I want to hear that you stop smoking by half. I only know one way to do this. Right? And I've done this before. And the reason I did it before, because all my teeth were falling out the front. Right? So, I'm going back, rather than buy smoking tobacco, I'm going back to Copenhagen, and I'm going to start dipping again. The teeth don't fall out no more. I had them removed. So I'll chew tobacco. I told him. He goes, well, I can't condone that because that could cause cancer, all kinds of shit. He goes, but at least we're not going to have a bunch of tar in your coronary arteries and stuff. So in other words, I think he thinks I'm right, but he goes, stop it. I said, no shit, but I'm so addicted to it. He goes, well, we're going to work on that too. We'll get you Chavez or something like that, or we'll see if we can't get you hooked up with the VA smoking cessations and stuff like that. But that's my first goal. So wants me to walk, start walking again. Start with 5 minutes a day. I work myself back up to 30 minutes a day. Where the other neurologist at OSU Ghetto East told me exactly the opposite. And he told me a bunch of shit that were fibs. And I was sitting here worried that I was going to die since the last week of October. So I could see this guy. He's like, no. But once you start strengthening your body, walk it a little bit. And I don't know how my body will respond to that, because I got problems in my lower back too. It's not used and it's not strong. I don't know. I'm going to try. And I got that the lower disc degeneration. It hits that nerve. What's that called? Starts with S. Oh, it feels like there's lightning going down my leg. That's when I start falling down and just walking down the street all the time. So it's kind of embarrassing. So take your time and just do it. So that's what I'm going to do. Do what he said. I don't know if I can get off nicotine, but he wants me to reduce my smoking at least by half. So guess what? This is the exact opposite of why I quit tipping Copenhagen. That was because of the teeth falling out in the front and making me look stupid. This is life or death, and I'm pretty sure that I can stop smoking and just start spitting in a spit bottle, and chew tobacco. At least, I mean, I still get my nicotine, but at least I won't have all that tar and stuff in my arteries. So that's how I'm thinking about this. I better get off here because I'm almost come to my end of my time allotment they give me at YouTube. But that's how this sergeant's feeling. And God bless America. And let's do this shit. Bye. Bye.